Ladies and gentlemen, it's so good to see and hear rather that so many people are on the phone call today. We're all learning the wonderful effects of BEMER, and I've been utilizing BEMER for almost 13 years in clinical practice. I've been serving as a consultant for BEMER for about 12 years. And through my time of using BEMER clinically as well as for myself, I've also seen amazing results. And I'm going to go over some of the ways that this works, not necessarily the individual results because they do vary, but I do want to cover some of the ways BEMER works. So the how, in essence. So how does BEMER work? And more importantly, why is it so effective? This is one of the things that I looked at many years ago. I looked at many different devices, and I've tried a lot of different pulse electromagnetic field devices, and BEMER truly is in a category itself. BEMER is an acronym. It stands for Bioelectromagnetic Energy Regulation. It is a Class 2 cleared medical device that stimulates muscles to support proper blood flow and helps maintain both structural integrity and functional physiological activity or functional physiology within the body. The BEMER therapy is designed to support the body's self-regulatory mechanism, fundamental physiological self-regulatory innate. That means that which is inside, which you're programmed with when you come here into this planet and you're living. And we'll talk more about that in detail. This also means that BEMER promotes the improvement of various physiological functions in the body. While BEMER is a muscle stimulator, its actions and results go far below that coil tissue interaction. And BEMER users report for many years stress reduction, better sleep, better moods, feeling stronger, more powerful, feeling more alert, more strength, and better recovery, as well as a lot of different and a whole slew of other benefits. BEMER is an integral part of those individuals seeking to live a healthy lifestyle. BEMER is an adjunctive therapeutic modality to support you and your lifestyle. So I want to invite you to open your mind a little bit and remember what a true miracle the human body is. Think of the incredible factoids that I'm going to share with you. And Bettina went to a couple of them, but 80 to 100 trillion cells in the body. 500 quadrillion protein molecules are made per second. 21 sextillion chemical reactions are occurring every second. And why and how does this happen? It's not just happening on its own. It takes a force, a driver. It takes energy. And energy in science is a currency in the body. And that currency is ATP, adenosine triphosphate. That's involved also with moving all the nutrients, the 2,000 gallons of blood per day that moves through your body. And ladies and gentlemen, most of you have 5 to 6 liters. That's 1.5 gallons of blood that's pumping through your body all the time. The same blood, which is cleared, cleaned, and moved around based on functional metabolic needs. That's a lot of blood flow, that's a lot of movement, and that's a lot of action. And so it's not surprising that every body, no pun intended, they need raw materials. They need oxygen, they need nutrients, they need to be delivered to the target tissues and clear the waste products, carbon dioxide, and the metabolic waste products that occur just like our car when we hit the gas. Unfortunately, we're not driving much these days.
But this is for my mama.
But exhaust is great. Please do mute yourself. I heard a little one talking about mama. So when we look at the common denominator of functional blood flow, this is the vessels that permeate all tissues within the body. And when blood's not flowing properly, I'm bringing this up, and Bettina did a fabulous job about going through this, so I'm not going to go too much in detail, but I do want to go over some things. Before we get into more specifics about diminished blood flow, I want to explore some concepts regarding the basic functionality of how your body works. And I mean, these symptoms, everyone's felt stress, restless, discomfort, unfocused energy, unfocused mind, low energy, fatigue, malaise. I like this depiction of an iceberg because it's very relevant from a clinical perspective when it comes to practicing medicine. Patients don't generally walk into a doctor's office and say, hey, this is my diagnosis, this is what's going on. In fact, it's just the opposite. The doctor has a unique role to identify and treat the underlying cause of a quote unquote disease. And not to suppress symptoms, but to utilize symptoms as flags, as little clues to investigate deeper to find out what the true nature of the discomfort or the dysfunction in the human body is. You know, it's important that we need to know as doctors what's going on, and that's challenging. Whether you're a good doctor or you're not a good doctor focuses on the underlying cause. And so when we look at this iceberg, the majority of the iceberg is underwater, and it's the same in the body. Just because you got an itchy skin or maybe a sniffle or a cough or maybe an icky wrist, there's always reasons why this is happening. They don't just pop up overnight, and sometimes they do, but generally there's a rhyme and reason. So we're not usually aware of what's beneath our symptoms or why we're even having symptoms, why they're occurring. One of the most crucial underlying issues for many folks out there is they don't have good blood flow. They don't have functional blood flow. And just because you can put your finger here and feel your heartbeat doesn't mean that you have functional blood flow, especially in the microcirculation. If blood is not flowing well, you're going to have decreased delivery of raw materials like nutrients and oxygen, as well as the cells need to function properly. So they need to clear out that metabolic waste that I talked about. This leads, if it's not happening, this process to decreased bioenergetics. Bioenergetics means mitochondrial dysfunction, and therefore you're not pumping out the energy, the ATP, the currency that we need as human beings to function optimally and live to our highest potential. So if you get nothing else out of this little slide here, I want you to remember this. And this is where the BEMER has the highest impact, beneath the surface. I get patients all the time that say, you know, I don't really feel the BEMER. Is this doing anything? I tell them to just relax, wait, and allow the BEMER to support you and facilitate your own self-regulatory mechanisms, your autonomic regulation. And again, we'll speak a little more in detail about that. But BEMER is all about supporting you through stimulating healthy blood flow. I want to go right into a little bit of research here because this research paper is a meta-analysis of the incredible amount of microcirculation research over the past years. And it's titled The Human Microcirculation Regulation of Flow and Beyond, and is the most cited research paper ever in the history of publications within the field of microcirculation. For those doctors, researchers, clinicians, scientists out there, this is a fact. And when we look at this this particular study, this research, this was published by Dr. David Gutterman in 2016. Here's me on the right with Dr. Gutterman. And I met him and had some good conversations down at the Experimental Biology Conference. We were right here down in San Diego. And I'm going to go through some of the details that and I'm going to read it verbatim here. The microcirculation is responsible for orchestrating adjustments in vascular tone to match local tissue perfusion based on oxygen demand. That means metabolic needs. It's tasked with providing nutrients and removing metabolic byproducts from virtually every single living cell in the body. And microcirculation plays a critical but sometimes indirect role in this tissue function. And this is one of the issues that, as physicians, we've had issues with diagnosing microvascular diseases or preemptive diseases that we'll go into that are from microcirculatory dysfunction. This paradigm of looking at microcirculation as an involvement with many of these complex conditions and diseases can help explain why microvascular dysfunction is such a powerful predictor of cardiovascular events and help identify new approaches to treatment and prevention. So that's a very powerful paper, and I would invite you to check this out, whether you're a doctor, scientist or not, even if you're an individual layperson that wants to know more about the subject. But Tina went over this very, very well. In fact, the microcirculatory system makes up the largest portion of the circulatory system. Almost 3/4 of your body are not the vessels that you can see. They are vessels that are sometimes less than 200 microns. What does that mean? I mean, I don't have long hair, but smaller than a human hair many, many times over. And so that is also something to be aware about. And I want to give you a depiction of this. This is a heart. And I know you don't see the structure of the muscles or the fibers, but this is the heart without any of that and only with the vessels. On the left side here, you can look at the heart under angiogram, angiography, and this, quote unquote, is the tip of the iceberg. These are the larger vessels, larger than 500 microns. This is when an interventional cardiologist, or when I do a CT scan and calcium scoring, and I'm looking, and 360 looking at the heart, I'm able to see blockages in those large vessels. But ladies and gentlemen, we do not have the technology in medicine at this time, unfortunately, to dig in and look at those micro vessels that you see on the right side, less than 500 microns. And it's at this interface where arteries, arterioles are bringing in the fresh raw materials and actions taking place in these capillary networks and delivering waste products through our veins and lymphatic system. I know it sounds so easy and, oh, sure, we just take it for granted. But this is one of the primary areas where disease manifests, and most importantly, it's preventable, because many aspects of how this dysfunction occurs with not being able to work within this central area of capillary network in a functional way is because of our lifestyle choices. It's not your genetic inheritance, usually. So I'm gonna go into a little more detail on this. Bettina talked about vasomotion. This is a depiction of vasomotion. Our vessels are in motion. They're not solid tubes or pipes. They're flexible. They're motile, hopefully. And if they're not able to move and they're not flexible, our blood cannot flow optimally. So if you hear about calcium, arteriosclerosis, thickened or stiffened plaques in the arterial walls, this isn't a good thing. And this isn't something that just popped up overnight. This is due to a combination of genetic, or should I say epigenetic, relationships to choices that are made within our environment. What we see, taste, feel, hear, experience, eat, drink, and how we process that information. One of the main mechanisms of the action of BEMER is directly on vasomotion or vasomotor function. These are autorhythmical contractions, or oscillations is a better way to put this, that are occurring in healthy individuals. And again, this is independent of the heart rate, cerebrospinal fluid, the respiratory rate. These oscillations are occurring, hopefully in a healthy person, about every 20 seconds, 3 to 5 times per minute. In an unhealthy individual, maybe individual with comorbidities, a 65-year-old, cardiovascular risk, diabetes, they may have these vasomotor oscillations which are governed and modulated by the nervous system, maybe 1 or 2 every 5 or 10 minutes. We have to be able to be flexible and responsive to our environment. And if we're not flexible and responsive to our environment, and it's very apropos right now in our situation in this quarantined and hunkering down in our houses, we have to be able to adapt, and we will adapt. We want to be able to respond to our environment, not react. So what does this mean? Healthy individuals, non-healthy individuals, how's this vasomotion so important? And if you don't have proper vascular tone and mobility, blood can become stagnant. And when blood becomes stagnant, disease can manifest more readily. So what causes these restricted vascular motilities and tone? Here you go, some examples: noise, overstimulation, environmental toxins, stressors, poor diet, lack of movement, stress, worry, anxiety. Stress, worry, and anxiety are not the same for everyone. They're unique, like pain, in the eye of the beholder, or rather in the body of the perceptor is how I should put that. Oxidative damage, aging processes. You know, symptoms of poor blood circulation, we don't talk about this so much. Like, what are symptoms of poor blood flow? How about numbness or feeling of pins and needles in the hands, cold hands or feet, tired or heavy feelings in the legs? Hair loss even on the legs can be because blood is not flowing there. Think about a tree when it's not getting moisture, it's not getting nutrients. The first things that happens to a plant is the leaves start to die, wilt, unless the problem or the deep-rooted issue is in the roots, and then the whole organism perishes. You can see edema, swelling in the feet, dry, itchy, pale, bluish red, kind of looking skin. We know what it looks like to have poor circulation, and we may not always know what it feels like. Sometimes varicosities can be issues. Slow healing wounds or sore. These can be also aspects of poor circulation. Or maybe it's just you're feeling sluggish. Your vitality's low. Your energy is just not up to par. All this can be related to dysfunctional blood flow. Here's another study, and this is a special report that was published by the American Heart Association titled Small Blood Vessels, Big Health Problems. And I'm going to read verbatim here for those of you who maybe aren't reading the screen. Microvascular complications are well-recognized effects of long-standing hypertension or diabetes. In addition, small blood vessels themselves cause or contribute to a diversity of diseases and pathogenic processes. Pathology is disease, such as hypertension, dysfunctional blood pressure, for example, coronary microvascular disease. This is disease that starts at the small blood vessel layer. Pulmonary hypertension involved with the lungs, sepsis, focal strokes, microinfarcts, microscopic hemorrhages, dementia. And I'm going fast through these because I'm telling you, it's irrelevant what we're really talking about. BEMER is not a disease-specific orientated medical device or therapeutic modality. Take a look on your screen. These are high evidence: bowel disease, cardiac, dementia, hypertension, lupus, stroke, sleep apnea, vasospasm. These are all high evidence respective relationships to microcirculatory dysfunction. And the truth is, many diseases are either causal and or correlated with this dysfunctional circulation, or should I say it more correctly, dysfunctional microcirculation. You know, we think of BEMER, and for those of you who are new or just listening, when you think of BEMER, you have to think or look at BEMER as a vascular type of therapy, something that affects the vessels and the circulation. BEMER is best known for positively affecting the circulation through its effect on the smallest vessels, microcirculation, by stimulating vasomotion. These small vessels are embedded with the vasculature, embedded throughout the tissues and organs, and are responsible for the distribution of blood within all tissues in the body virtually. And if your blood's flowing properly, generally you're going to be healthy. Yet getting your blood supplied to the tissue is the issue in most people with chronic disease. I say this a million times and I'll say it again, make no mistake about this, healthy circulation is the cornerstone for health. So now really we're going to get into this. How does the BEMER work? This is twofold. As with all PMF technology, BEMER stimulates the vessels within the body and all tissues through inductive stimulation. Take a look on the left side. BEMER therapy system stimulates cells and tissue through electromagnetic inductions to elicit microcurrents within target tissues. This results in increased metabolic and cellular function. For folks who don't understand this or what induction means, I want to go over this briefly. Induction means, well, anyone who has a toothbrush that is electric that they charge, they don't plug the toothbrush in. They actually plug the charger in and set the toothbrush on the charger, which then inductively stimulates those lithium ions within that battery structure to charge the toothbrush. The same thing happens with my phone. I haven't charged a phone plugging it in for years. I place it on a Qi charger, an electromagnetic charger that then can fill the battery. And this is exactly what's happening in the body through induction of microcurrents. This then brings the energy up, raises the energy, not just in a muscle group, but at a cellular level. Think about that, at a cellular level. That means that BEMER electromagnetic waves transfers energy and stimulate function of the body, not just the geometry of the cushion or the coils, but has unique functions beyond just what's happening under the coils. And one of the ways that this works is because of vasomotion. How does this work? Because of BEMER's patented signal. Not only does the waveform have this unique function, but the proprietary signal that stimulates vasomotor function or vasomotion through both neurovascular and neurohormonal 10 and 30 hertz combination, which increases blood flow while the body self-regulates as a whole. This comes down to neurological regulation through parasympathetic, sympathetic with autonomic regulation. The autonomic control is what modulates your vasomotor function. This has directly to do with how you are able to integrate with your environment. Okay, so when we think about BEMER, it's all about supporting circulation, maintaining functional blood flow in the microcirculation. Okay. Bettina put this up as well. And yes, there are 12 organ systems that we look at, but I want to focus on not just the circulation of the BEMER, but the relationship between circulation and other tissues, to be specific, the muscular system. And there's another mechanism that BEMER works with to provide you and your patients, if you're a doctor, physician, clinician, with effective results. And again, that's induction. I talked about the inductive direct therapeutic intervention, interrelationship, and vasomotion, which also is local, but also has a far-reaching effect. The inductive stimulation isn't special to BEMER. I want to be clear about that. In fact, I've literally wrapped extension cords in the rural communities over broken bones of the leg to transfer energy in this way. But all PEMF have some level of inductive stimulation when applied to the body. And the relationship between blood circulation and muscle function is literally like a car's need for gasoline. Well, unless you have an electric car, the need for electrons. You're actually charging a battery. And each and every single cell, including red blood cells, act like little batteries. They need to be charged and maintain their charge. And if they cannot hold the charge anymore, there's a mechanism within these cells called cellular apoptosis, and they should be programmed to die, programmed cell death. And this is how we regenerate. This is how we recover, and this is how we grow and adapt to our environments. So improved and functional circulations does help you to perform optimally and supports recovery. So we're full of muscles, not just cardiac in the heart or smooth muscles that are in the vessels, or smooth muscles that are maybe in the eyes that open the sphincters of the eye, for example. And when I say the eye, I mean the pupil. But skeletal muscles are the most ubiquitous muscles throughout the body. And we have to keep in mind there is a difference between the smooth and skeletal muscles. We all know the function of the skeletal muscles are that of mobility, stability, and strength, and they're regulated by conscious movements. But the action of the smooth muscle is regulated by the autonomic nervous system, unconscious movements. Sympathetic on one side, which is fight or flight, and parasympathetic on the other, which is rest and digest. Unfortunately, many people are locked into a stress situation on a daily basis, and they're in the fight and flight mode all the time. This doesn't just have an effect on your psyche, on stress levels, on worry, on anxiety, but it literally has a direct effect on how you can serve your cells and provide them with the nutrients and the raw materials that they need to survive and support you as a whole. Arterioles are major resistance vessels, and the smooth muscles, the precapillary arterioles, are responsible for regulating the diameter of the vessel, opening and closing to allow appropriate blood flow based on the metabolic needs of the tissues. What's needed in that region? I said there's only 1.5 gallons of blood that's moving through your body. All the blood can't be everywhere at once. So there has to be a functional way to divvy up where that blood goes based on the need, just like these checks or this money that's coming in for this from the government during this COVID type of thing. It has to be appropriated appropriately. So on the left side, what we can see here is we can see when these vessels are closed or constricted, the precapillary sphincters, when they're open on the left side, they're relaxed. This allows blood flow to move through it. And again, this isn't an on and off switch. It doesn't just close or open. It's a dynamic process. It's a dance. It's really a beautiful process of the feedback mechanism between the periphery and the central nervous system. On the right, you can see when they are contracted and when they want to limit blood flow, as far as the smooth muscle, they can constrict and then redirect blood to different regions. This also changes pressurization, which changes the delivery or availability to deliver nutrients and pull out waste products functionally. This mechanism is very, very tightly controlled in healthy people and animals, but when it's not working, ladies and gentlemen, it is a recipe for disease. So when blood's flowing, amazing results can occur. Take a look at this here. Performance, muscle conditioning, physical fitness, strength. Where does strength come from? Where does endurance come from? You have to be able to breathe and move in relationship to flowing blood and have that musculature conditioned in such a way that it can respond to environmental stimuli. That means if you're running, if you're not conditioned, you're going to go kaput. And then you're gonna feel it within hours of the next day. We call this delayed onset muscle soreness because that acid builds up there, and in unconditioned muscles with poor circulation, you're not able to recover as well as you did maybe when you were younger or when you were training more often. Through muscle stimulation, the BEMER device may be used to, one, promote overall vitality, relaxation, well-being, and relief of stress. The indications for use under Class 2 FDA clearance are, and I'll read them directly, to temporarily increase local blood flow, circulation, and healthy leg muscles, and to stimulate healthy muscles in order to improve and facilitate muscle performance. This isn't one or another. And while these indications are focused on muscle tissue, we know the effects of BEMER signal, or the field, goes far beyond the coils, and they can have far-reaching effects impacting microcirculation throughout the body. Through stimulating the muscles, both the skeletal and smooth muscles within the microvessels, the BEMER can be used to promote overall vitality, relaxation, well-being, and relief of stress. You can't help to put the BEMER on the body and have effects on muscles, but it's not just going into the muscles, it's affecting every single charged particle within your body, down to even salts, which means sodium, potassium. These are electrolytes. Electrolytes are charged. Electrolytes. They're electric. They have electrons. And when BEMER interacts with electrical fields or any pulsed electromagnetic fields, it raises their energy to a more dynamic and energetic state. Energy cannot be completed or destroyed. It can only be transferred. Don't forget that. Very, very important. Some of you may be grossed out by this, but this is us. What's under your skin? And so why is muscle so important? I want to go to this because we don't talk about this much, but we're going to today. It's not just that it looks good to be lean and fit or feels good to be healthy. Muscle is metabolically active tissue. And what does that mean? It means that it burns energy just to keep you going, to keep my mouth moving, to keep me upright. When you are laying in bed, when you stand up and you engage with your day, you're burning energy all throughout the day just to keep your structure in a place of functionality, or it's unfortunate, to maintain dysfunctional postural positions. So muscle serves to support both structure and function. Muscles connect our bones, connecting us to keep us strong, mobile, stable, protected. And while they provide us with the capacity to move around in our environment, like all things, if you don't lose them, if you don't use them, you lose them. From our 30s on upwards, and you're going to hear a term maybe that you don't know about today called body composition. I don't look clinically, and I don't even agree to look clinically or even personally at the scale. When you look at a scale, you're looking at overall mass. And that doesn't give me as a doctor much information. And it's poor to say, oh, my BMI is this much based on my height and weight. What about the athlete who is incredibly strong and they would look morbidly obese because they have so much muscle mass on board? We begin to lose our muscle mass, muscle strength, and endurance, and aging has been associated with the loss of muscle. We call this sarcopenia, or loss of muscle mass. And the aging process, if not kept in check through muscle conditioning and exercise, continues to cost us our muscle tissue through loss of our lean muscle. And this, excuse me, and as we continue to get older, this directly results in diminished muscular function. And this leads to issues beyond just the musculoskeletal system rather. In the center of this slide, please stare at it because I'm going to say it and I'm going to say it loud. If I had one biomarker, and not a lab test, not this, but if I would run a bioimpedance analysis or some type of analysis where I can measure lean muscle mass, which I do virtually on every single patient that I've seen, is the #1 biomarker for aging. How much lean muscle mass do you have on board? It's an excellent indicator of your overall health. With that said, I want to talk a little bit more about circulation and muscle performance because chronic muscle tension causes discomfort, causes tightness, pain, weakness, and it can cause dysfunctional posture, forward pressing of the neck, slumped, slouched body position. This compresses the vascular, this compresses the vascular and nerves, causing hypoperfusion or decreased blood flow. This hyperperfusion can cause then low oxygen levels. called hypoxia, and hyperacidification, acid buildup. And what this does is goes full circle back to cutting off functional blood flow through compression again. Your body's trying to compress or contract to stabilize maybe a weak joint, which is maybe grinding on a nerve, for example, which will impinge a nerve. So it's a double-edged sword. Relax the muscle, get the blood flow, but then destabilize. And so a functional analysis of your body system, not just quote unquote treating yourself with the BEMER, is important and mandatory if you really want to make long-term changes. We need a drug-free solution. We're tired of this opioid type of injection, a pill for every ill. We need drug-free solutions and complementary therapies like BEMER to support individuals in living up to their highest potential and supporting their optimal range of recovery. Bettina also showed this image. It's really quite simple. The B pads orientated vertically up the spine, you can see here, to deliver a localized BEMER application to that target tissue of the back. But despite the field interaction within the muscles and tissues of the back in this particular user depiction, the effects of BEMER do go far beyond the coils of just the field. And I want you to remember again, keep in mind, all these waveforms are not created equal. They're not the same. And I want to take a look at this. Joy just reached out to make sure. Okay, perfect. I'm not going to go over the details here, but all waveforms are not the same. You can look at the simple sinusoidal waveform here, the square wave, which many of our competitors use, triangle, sawtooth. BEMER is not even in the same category as other waves. And in fact, if you try to get to the BEMER waveform, you actually cross the patent that BEMER has. And so you can rest assured, not only is BEMER one of the most effective waveforms in the world, on this earth, as well as in space, it's one of the safest as well. And you get these changes or results in the body because of this unique escalating growth and drops. And we'll go into a little more detail with that. This is actually a quote here from a study that was published by NASA, and it says, it's just an excerpt rather. There's important parameters that involve the wave shape or waveform used, and the intensity, flux, density, as well as the frequency are important. So field energetics, frequencies, pulse, shape, waveform, amplitude, spatial orientation, these have to be precisely defined. And just like a drug that I take in my mouth or a nutraceutical, it goes into my body, it binds to lock and key receptors, turns things on or turns things off. Waveforms can do the same thing as they interact with biological oscillators within the body. And it is the spectrum of frequencies for waveform, timely variations in the electromagnetic fields that interact with our cells to give rise to the desired physiological effects that we see with our beloved BEMER application. And yes, I am going to bring up NASA a bit. George did ask me to do that. And so we have been working, BEMER has been working with NASA under a Space Act agreement as a part of this research development project. NASA, JSC, Johnson Space Center, has chosen BEMER to work with them. And our goal together is actually for the Mars mission, but will be applicable to the lunar surface. Once that thing gets running back, it's on hold for right now. But to develop technology of integrating undergarments of spacesuits to countermeasure muscle bone degeneration, and most importantly, dysfunctional blood flow, microcirculatory blood flow. And this paves the way, or rather this joint venture paves the way for the integration of BEMER technology into human space flight, both exit preparation, re-entry, and space missions themselves. The final aspect of research that I do want to go over, and yeah, let's look at a little bit of BEMER research looking at this device. Bettina went over this, so I'm not going to go over details, but I am going to go over, not details of this, but more in detail. 5 devices were looked at, okay? And when we looked at these 5 devices, effects of various physical treatment methods on arterial vasomotion and microhemodynamic functional characteristics in cases of deficient regulation of organ blood flow. This was done by Dr. Klopp many years ago, 2013, and the results were conclusive. Only one medical device was possible to show an increase in stimulus of vasomotion, and it was the specific biorhythmically defined stimulus that focuses on the microcirculation vasomotion. That's BEMER. It's not any other device. that has the capability to do that. This is the percentage change in partial pressure of oxygen. And again, take a peek here, because BEMER was utilized with the other devices for 4 days. It was literally shut off. All devices were shut off at 3 days. And BEMER still outperformed, even after a full day of being off, in microcirculatory parameters of measurement than all of the other devices together. Take a look here. We're not just looking at oxygen. And this is venous return. So that means the ability for blood supplies to return. I'm going to click the next here. Good. This one here was looking at nodal points perfused. That means as we look down from maybe a 5,000-foot view, you can see highways and different cars moving through the highway and then the streets on the side. The same thing is true for our vessels, the large vessels, the smaller vessels. And we look at perfusion of nodal points, intersections. And BEMER thrived when looking at the blood circulation of overall movement and dynamicism of hemodynamics. This one looked at arterial vasomotion. You can also see the aspect here of being far superior to any of the competitors. And the results conclusively are here. Improved vasomotion, more capillary perfusion, improved venous return, more oxygenation of tissues. That combination of parameters, not a single pulsed electromagnetic field in the industry has been able to show those type of results. So you should be very excited and proud of your product, and if you are interested in the product, knowing that you are going to be utilizing a product that is so unique and beneficial to yourself. Benefits for using BEMER. BEMER increases blood flow. This brings nutrients and oxygen to the target tissues and removes metabolic waste. This gives the BEMER user the feelings or sensations of one, enhanced energy, strength, vitality. And as we support our musculature, we ultimately support our cellular health as well, which enhances physical fitness, enhances endurance, performance. And one of the unique effects of BEMER is so many users report is less feeling of stress, feeling more relaxed, and just an overall feeling of calmness. When your nervous system is balanced, your autonomics, parasympathetic, sympathetic are in a balanced state, not only do you appear to be more relaxed and restful, your body's responding in the most functional way it can within its microenvironment and macro environment. BEMER Air therapy, it's a simple medical device to use, a very simple product to use, and most importantly, it's safe, it's effective device to utilize to increase your circulation and support the optimal function of your musculoskeletal system. With better circulation, we have better health. With better health, we can live a better life that we are designed to live. We're designed to live a healthy life. So it's not just about longevity, it's about the quality of your life. I'm inviting you, for you new folks, as well as for us who are existing within the BEMER community, the BEMER family, start living your best life for you and make BEMER an integral part of your healthy lifestyle. Thank you, George. I want to pass this over to you and continue.